is a huge honor today to be interviewing a dental implant rock star, Vance Costello. And I think looking at your cases, I think first we got to address any relation to the musician.
No, not that I know of, but
Or
I haven't checked that deep yet, though.
you haven't checked that deep? Or do you play any instruments? Do you sing? You dance? Who's the musician? Elvis Costello?
I can play a radio. That's about it. But
you know, it's amazing how many implant legends are from Louisiana. I mean, you got to think of Jerome Smith. I mean, you got to think. I mean, what is it about Louisiana where people just have less fear of placing implants?
well, I don't know. You know, Jerome was my mentor. So
Really,
you know,
I did not know that.
yeah. So I've heard about y'all's fishing trip and all this kind of good stuff.
Was it? I'm not sure if it was a fishing trip or a drinking trip. The Louisiana boys, they make this yellow concoction, and I think they just pour all these. It's yellow. You know what I'm talking about?
Oh yeah. Oh yeah.
Oh my God, it's liquid kerosene, and you want to. And yeah, those fishing trips. I'll never forget waking up one day out there in the bayou of after red bass fishing, or what do you call it? Redfish.
Redfish.
Redfish, and I took 4 of my boys, and I woke up, and 2 of them were sitting on an alligator that was alive, about 12 feet long, that had got lost in the ocean, totally bloated, came to shore, was so bloated and sick, and my boys were sitting on him. I'm just like, oh my God.
Oh yeah. Well, we do alligator hunt, so that is a season here.
So my first question to you, the $1 million question, and you can take the whole hour to answer if you want, is when you go to Korea, 15,000 out of their 20,000 dentists place an implant every month. When you go to Germany, 3 out of 4 dentists place an implant. When you go to Brazil, a lot of the dentists don't even know what a bridge is. They just place implants. And then you come to America, and dentists won't place an implant, yet they'll pull a tooth. And how can you pull a first molar? How do you have the skill to take out a first molar, but you don't have the skill to replace it with a titanium screw? Well, what's up with that?
I don't know. Everybody's so scared about it. I do some live surgery courses. I just got through doing one in New Orleans this weekend, where the doctors come here in Louisiana and they place implants on patients. I do it with Dr. Daryl Berg, and then also did one out in Tijuana in California with Ike Tall. Went with him, and you know, a lot of these doctors are just scared to do it, and they would rather place a bridge there. One is much quicker to do a bridge, but you know, they got to look down the road at what's going to happen. You know, when these patients get older, or when they can't clean, and you know, the bridge is going to fail when they get a dry mouth, and you know, so I'm talking to them, but they're just afraid. And you know, in dental school, they only chose 2 students, the top 2 students out of my class, to do a implant class. And I graduated in 2005, and I was one of them. And my friend that I studied with was one of the students. And all we got to do basically was check implants that were already placed, and we got to hook up some locator dentures, and that was about it. But they told us, you know, just send these off to the specialist. Don't worry about this. So,
yeah, and when specialists tell me in their arrogant tone, well, if you want to do ortho, go to ortho school. My response is these schools are paid by the taxpayers of the whole state. Right. When dentists complain about how much tuition and student loan debt they have, I like to remind them that their tuition didn't even cover 25% of the cost of their school. The taxpayers did. And half of America lives in 117 metropolitans where you have all the specialties. But the other half of America lives in 19,022 towns, most of which don't have a single one of these 9 specialties recognized by the American Dental Association. So these dental schools have to realize if they're paid for by rural tax dollars, they got to send girls back to that village that know how to do a little bit of all that stuff. And you know, in all the specialties, like in endo, the dentists do all the easy ones, and they send the hard ones to the endodontist. In oral surgery, we pull all the easy teeth, and we send the impacted whizzies to the oral surgeons. But the orthodontists don't want to say, oh, they'll do all the class 2s and class 3s, and general dentists should learn simple ortho for all the easy ones. And implantology, I'm not even sure what specialty is in charge of implantology. I mean, the periodontists are all implantologists. Do you even know a periodontist that's not placing implants?
Not in my town. We don't have many, you know, but no.
Yeah, and the prosthodontists are placing them, the periodontists are placing them, the oral surgeons are placing, everybody's placing them, but except for everyone listening to this podcast.
Exactly. Yeah, I know.
So let's start. Let's start with square one. We didn't learn this in school. My ortho training in school was about complex facial genetic mouth maladies, and it was just all theory. Not zero practical anything you could do, and implants. I mean, in all seriousness, I'm so old. When I got to school in '87, the one oral surgeon that was placed, it was subperiosteals back then.
Oh,
it was
yeah.
ramus frames, and everybody called that oral surgeon the butcher. And they all talked about him, that he was a nut. And then when I opened up in '87, the guy across the street from me was doing subperiosteals and ramus frames, and everybody made fun of him, that he was a butcher. And some dentists actually had their licenses taken away because the first time one of their implant cases failed, the board would take their license away. And now here it is 28 years later, and now we're fighting that ancient bias that these guys are butchers. So my viewers listening to you for an hour, most of them are on their commute to work. They've never placed an implant. You're telling them to go to the second floor where they're placing implants like a big boy like you. What's the first step? What's the second? How do you go from never placing an implant to doing what you do? How do you start? Walk us through the process.
Well, when I was in college, my wife and I both went to dental hygiene school. I knew I wanted to go to dental school, but she wanted to go to hygiene school, so I said, hey, I'll go with you. So I was the only guy in a class of 24 women.
Are you serious? You started out in hygiene school? That is so. And you went there just for you were married at the time, or you were chasing her?
I was married. I was already caught. So,
Okay.
Yeah. So,
that is so cool. Are you an RDH?
I am.
That is so cool. I got to tell you, I'm sorry to interrupt your story. My dad's brother, Mike, was the first male nurse from Kansas. And the only reason he went to nursing school, Parsons, Kansas, where mom, dad, and everybody was raised. And Aunt Shirley, he never got Aunt Shirley in high school. Found out Aunt Shirley signed up for nursing school, so he signed up too. It was a 4-year program. She didn't go out with him until like 3rd year, and he married her before graduation. And when people say, well, why'd you go into nursing? He just points to Aunt Shirley.
There you go. There's my answer. But, I thought it'd be a good stepping stone. So, I didn't know what I didn't know back then. But, it was good to get that experience, get those hand skills. First day of operative dentistry, when you're looking through a mirror on a typodont and your hand's going the wrong way, I already had that, skill set. But, I knew I wanted to do something in the dental field. So,
That's my Mimi. Sorry about that. My Mimi.
Oh, okay. I thought you were playing the screen there.
My Mimi, I'm kind of busy right now. I have 2 cats. I'm one of those weird cat women who's actually a man with 2 cats.
That's okay. That's fine.
My Mimi is the only girl I've ever found that I'm able to live with in harmony.
Well, there you go. There you go.
She's absolutely perfect. But anyways.
Yeah, so, I went on to dental school and did hygiene work while I was in dental school. But as I was doing this hygiene work, I seen these failing bridges and people that had many missing teeth, and, there had to be something better. So, I got with Jerome Smith because I knew he was, a good implantologist. And actually, a girl that I went to hygiene school with, she was his hygienist. So that's how I kind of got in with Jerry. Of course, he's a cool dude, and so I took a few courses just to kind of get along and learn a few things. And then I would go over to Jerry's and, watch him take in as much as I could. And then, my first case, I had a patient that I knew, and he needed some dental work done. So Jerry said, let's jump on it. And, of course, it was 8 implants and 4 in the sinus. So, he helped me do all that. But the main thing I did to start out with was to find a good, simple course. Zimmer has them. I think the first one I took was Camlog. Did that, and then started growing on that. Got a mentor, and then when I wanted to learn a little bit more, I took the Maxi course at AAID. Went on and got my associate fellowship. So kind of baby steps in your comfort zone. That's where I was started at.
So what would you recommend this person sign up for?
Well, the first one I did was I think it was through Shine. It was a Camlog course, just to go and look at some surgeries and see what was going on. And
Camlog, that was started by Jerry Disnick, wasn't it?
I think so. I believe
Jerry
so.
Disnick, and then he sold that to Dentsply.
That's right.
And then when his 5-year contract, covenant not to compete, then he went out and started Implants Direct,
That's right.
And then he sold that to Cyber Kerr.
That's right. That's right. Yeah, I think he had the internal connection there for Zimmer or something like that, wasn't it?
Yeah.
That's what it was. So yeah, just a quick, easy little course to begin with, just to see, what I was getting myself into. Because I didn't learn much in dental school, and then I started getting with my mentor Jerry, which I think is very important because there's things you learn from somebody one-on-one. If you go take these courses, you're pretty much going to see just the best cases. Look what I did. This worked the best, and they never show you, anything that failed or the problems. So, the good thing about my mentor, first thing he showed me was the things that failed. And it's hard to get in a comfort zone when you start doing surgeries, especially by yourself. What goes on, what happens? And with my mentor, he showed me, hey, if this happens, this is what you do. Okay, if this happens, this is what you do. So you kind of have a safety net, and when you learn what to do when something goes sideways, which it always is, you know how to fix your problems, and you know how to get yourself out of a bind, or you have somebody that you can call and do this, because most guys that will go and do these weekend courses and learn how to place these implants or put some in, which are fairly easy cases we select for them, once they have a problem that goes on with they don't have enough kg on the buckle or the implant didn't take, they bail and that's it. They don't want to do it anymore because they don't know how to fix the problems when something goes wrong. And I think that's very important to learn, is have somebody you can call, you can talk to, and learn what to do when there's a problem.
And his what is it? His nephew, Daniel Dominique, who's in his practice.
Danny.
What's that, Danny? Yeah, Danny Dominique. I mean, he's already a legend. I mean, that guy's amazing. And I still think, if someone has said to me, who do you think's the greatest dentist who's alive today? God, that'd be a tough call. There's so many greats from Gordy on, but god dang, Jerome Smith would have to be right near the top. And what you just said was what all the greatest ones have, and that's humility. And only Jerome Smith could go up there and lecture and say, you know what, I'm going to teach you everything I know from everything that I've seen fail. And he shows his own failures, how he's fixed other people's failures. He's just a humble guy. He's just good from his head to his toes. He's just, what a great guy.
He's talking to me after he showed me a lot, and I got going very good. Placing implants, placed a couple hundred of them, and then he said, hey, why don't you come over? I'm starting this course. It's called Black and White implant course, and that's the one he gives. He says, sit in on it and tell me what you think about it. See what you think. So he had these other dentists that were taking it, and he's going up there with these slides, and he's showing, hey, this one didn't work out. This one screwed up, and this is how I fixed this. And this is what we did, and it kind of blew my mind because all the other courses, all I saw was just the best cases, pretty X-rays, pretty finishes, and here this guy is, which is a legend. He places 100 implants a month, every month, showing us what went wrong, and I had to step back and think about that, and I was thinking, that's true. And he told me, he said, look, if somebody comes to you, if any doctor, surgeon, whatever, is talking to you and say, look, I've never had a failure, I've never had anything go wrong, you better run because he's not telling you the truth. So that's the main thing. I think you really need to learn, what to do when there's a problem. Of course, you got the easy cases, and, like I told my friends the other day, he had a pretty root canal. I said, well, that one's going to fail. And he's like, what do you mean? I said, well, the pretty ones fail. The one that has the silver point going halfway down the roots sitting beside it, it's not going to fail, but yours will.
You said something at the very beginning. You said it so fast and subtle. I think a lot of these guys didn't hear it. You said, when you do these bridges, when they get older and dry mouth, it's going to fail. And that dry mouth, you just said two words, that dry mouth. And then you talked about the ugly endos don't fail. I mean, because biology is what we're talking about. But when you go to dental courses, you'd think that it's being given by a mechanical engineer. So what I explained to my patients, I said, I can build the nicest wooden barn in the middle of the cornfield that you want me to, and then put all the onus on you to brush twice a day for 2 minutes and floss before bedtime and use a tongue scraper mouthwash. But you know what's going to happen? You're a human, and you're going to come back 6.5 years later, and termites going to eat this whole damn bridge. But if I build an aluminum barn out of titanium, and you don't brush it, you don't floss it, you don't do everything you're supposed to, I know my bugs, Streptococcus mutans, can't eat titanium. And when those people get dry mouth, the decay goes crazy. In fact, All the geriatric dentists tell me that specialize in geriatrics that when you put mom in a nursing home, they on average they lose one permanent tooth per month in the nursing home from just overwhelming root surface decay. And when I go into about a dozen nursing homes, because I've been out here in Ahwatukee for 28 years. A lot of people retire in Phoenix, and my God, when you see those ladies that you put implants on, and they don't even know my name. They have dementia. How can they brush and floss and take care of themselves? They don't even know the name of their own daughter. And those implants, and they're eating an apple, and they're chewing, and they're eating, and you just feel like, man, I did the right thing. So we got to think holistically. We got to think that aluminum titanium implant is at least is not going to be eaten by bugs. And I want to ask you this: a lot of people are saying that implants get periodontal disease just as much as normal human teeth. I think that's a crock. Do you think peri-implantitis is just as common as periodontal disease around human teeth?
You know, when I look at these, and of course with my hygiene background, I'm looking at the KG around it, and and the connective tissue, and the implants that I see that have been done well, just like a composite filling. If you do it well, it's going to be a great restoration. If you don't do it well, you could have problems with it. But an implant that has a great keratinized gingiva that was done right, I see all these other teeth have these problems fall away, and this nice single tooth is sitting there, and it looks just perfect. The other teeth may have perio, but that implant is doing just fine. So, what gives on that? What's the deal?
Well, I did not know you were a hygienist before, and I did not know. Is your wife? Did she go to dental school, or did she stay?
No, she said you can do that. Just go right on ahead.
Well, go ahead and tell us right now. How would a hygienist who's also a dentist and places implants, how would you recommend hygienists clean around implants? Some people don't want to put metal on titanium. Some people want to have special non-metal scalers. What is your thoughts on cleaning around implants?
I did a CE course at the local hygiene school here a few months ago, and I'm talking to them about checking implants. I go around them with a plastic probe, and I probe, and see what's going on. You can only get so much from a two-dimensional X-ray, and then they stopped me right there and they said, well, they have a specialist come in and teach different things there, and they said, well, they told us to never probe around the implant. I'm going, well, how do you know if you have any bone loss or, what's going on? They said, well, they told us not mess with it. We can get this little fat plastic scaler and scale around the abutment there, but, you really have to get in there and check it out and keep it clean. That's with anything. If you ever got a popcorn kernel around an implant, well, it's not going to be very happy. You have to go in there and get it cleaned out. Now, I don't mean go in there with a diamond instrument or, a sharp scaler and just rough it up real bad, but you have to go around, check it out, and clean it. But they're advocating not even to probe around it, not even to check it.
This might be a rocking hot. Your first online C course for Dental Town is RDH DDS, how to clean and prophylactically take care of an implant. Because I am amazed at how many dentists and hygienists tell me that you're not supposed to touch an implant with anything metal, a periodontal probe, a scaler, an ultrasonic cleaner. What would you say to those? What would you say if a dentist said to you, well, when you're cleaning, you can't scale or ultrasonic or probe a metal titanium implant? What would you say?
Oh, I tell them they're crazy. If you go back to the studies, we try to get a patient in every 6 months because the bacteria, they get organized. They hook, end to end and make that swaying motion, corn cob effect, and they start swaying. Well, every 6 months, by the time that 6 months come around, that's when you come in around the tooth and disrupt that organization, and then it knocks them back, to their basic bacteria. Okay, so if you're not scaling or cleaning around an implant and disrupting that bacterial maturation, what's going to happen? It's just they're going to mature, you get into a very virulent type of bacteria, and there you go. You're going to start having problems if you don't keep it clean. So if you can't probe around it, you don't clean around it, then what's going to happen? The bacteria is just going to organize.
Okay, it's my job to estimate and predict what thousands of dentists and hygienists are listening to this on iTunes are thinking, and the first thing you're going to say is, but Vance, you're going to scratch the implant. That'll make it worse. What would you say to that?
Well, okay. So what if you don't? If you don't get in there and clean it, you dang if you do and dang if you don't. But like I said, you can't go in there with an instrument that is, say, a diamond instrument, something rough. They have hygiene scalers with little rubber tips that, you use the ultrasonic around the implant. You know, that cavitation, which I think is great, is something that you can disrupt those bacteria, you know, lyse those bacterial cells, but not scratch the implant and or cause a nidus for the bacteria to hook to, just like barnacles on a boat. You want to keep it slick.
Man, I bet 1,000 dentists listening to this are wishing you'd make a 1-hour online CE course on Dental Town that they could sit down for a luncheon, get pizza, hamburgers, and watch you teach them and tell them how to what a perio maintenance should be around the implant. Well, you said you already made the lecture for a hygiene school.
I did. Yeah. I mean, I wouldn't mind doing that. That'd be great.
We would love it. I would love to have my Sandy and Sarah and Brandy all watch that. That'd be amazing.
You know, and the way things are kind of kept with, you know, specialists placing the implants, and they're telling you, you know, don't do this and don't do that, but they're not restoring it. And, you know, everybody kind of keeps things compartmentalized. We as dentists, we do that. We crawl in our cave and work for 30 years and then pick our head out after 30 years. You know, we're kind of introverts, you know, as it was. But, you know, the things that I see is when I was a hygienist and I'm a dentist now, is what I've seen with my patients as I clean my implants and the success rate I see on those. I've seen one today that's been there for almost 10 years, and it looks just like the day.
Now, do you use the same scalers you'd use on natural teeth, or do you use different scalers?
I try to use a scaler. You know, like I said, the ultrasonic with the little rubber coating on there. Like to use that.
Who makes that? Give them a brand or a website.
I think Hugh Freddie makes one of them.
Hugh Freddie, what a great company. That's a 100-year-old company. Did you
know
that's
an old company. Yeah.
Yeah.
But I do get around there and I do probe and check, and you know, we have some better implant scalers now that are more protective. I had to look and see what name it is, but you know, if you just pick up an old standby implant scaler, the big fat plastic one, you can't get that. You know, you can clean underneath a ponic of a bridge. That's about all you can do, but you can't really get around an implant and clean it. And they're worried about you breaking that biologic seal, but you know, if you can't get around there and clean that out, you're not doing any good for the implant there.
So you're teaching hands-on courses yourself?
I'm doing Dr. Daryl Berg. He and I took the AAID course back in 2007 together, and then we took an IV sedation course at UAB in University of Alabama, and we've been friends ever since. So he has it down at his place in New Orleans, and I go down there every quarter and help him manage the advanced cases, these sinus grafts, ridge splits, things like that. We're putting implants in. And he actually has an oral surgeon that works in his office, too. So,
And he gets that every 3 months?
I think it's about every 3 months. We just did, but I did one with Isaac Tallwell. I think you know him.
Yeah, we lectured together at the Megagen Symposium in Manhattan. God, that was fun.
That's right, yeah.
Gordon Christian and John Coyce, it was a blast.
So I went down with him to San Diego and Tijuana.
And now they go down there because they want to go to Mexico because you don't have to have a license. I mean, if
that's right.
If you want to do a hands-on and you went to a different state, you can't do it because that state's not going to let you do it. So you guys have one right across the San Diego border. Tell them about that facility. Who owns that? Is that Daryl Berg?
No, Daryl is in New Orleans.
Right. Who owns the Tijuana one?
To the dentist, I forget her name. I met her a couple times while we were down there, but we have her facility to use, and she has a bunch of patients there that need implants, and they get them done for free. And so that's the deal. When you're a U.S. Licensed dentist in state, you have to have that state's license to operate in that state. So at Daryl's course in New Orleans, you have to have a Louisiana license. Now we are working on something with the state in the United States where dentists from around the United States can come and do it here in the continent.
We know what we just figured out here in Arizona is the homeless shelter. There's a homeless shelter just for American vets, and Chris Volch's has been working there for 20 years.
That's what I'm talking about.
You're talking about that one? Yeah. So I told Chris, I said, just go to the Arizona State Board of Dental Examiners and tell them, can a licensed dentist in good standing come to Arizona and practice dentistry if it's in a homeless shelter for American vets doing free dentistry on American. I mean, how do you say no to that? And they said,
exactly.
you're right. And they gave permission. I'm just like, bada boom, bada boom, bada boom.
Yeah,
This
yeah.
is going to be fun. But Tijuana would be damn fun too. I don't know.
Oh, it was fun. No, it was tough. Now I think we put in 200 implants.
Is it safe down there?
Oh yeah, I was kind of scared. My wife was afraid I was gonna get my head cut off, but
because that last president in Mexico, the president only gets one term, and
right.
they said the one just resigned or just finished his 6-year term, and they said 60,000 Mexicans were killed in the drug war during his 6-year term, 10,000 a year. And I have to tell you, me and my buddy Craig Seigan, we always go to Cabo once a year for years, go down there deep sea fishing. I just love. Me and Craig just love deep sea fishing out there, like I do with Jerome Smith and in the bayou. And after like doing this every year for like 4 years, the last time there we were spooked. And you know why we were spooked? We got robbed. And guess who robbed us? Guess who robbed us?
American citizen?
No, the police.
Oh yeah.
We were walking back from the fishery to our resort, and the police pulled up behind us, the sirens, whole 9 yards, and frisked us, pat us down, took our wallet, took all of our cash, and then got in the police car and drove off. We thought, wow, when the police rob you,
that's bad.
You're probably not safe. But is Tijuana safe?
It's safe. I went there, and I've never been to Mexico on the border. Went there, we were right by an Applebee's across from a Costco, and there's American citizens walking around because on every corner you see a dentist or a plastic surgeon or orthodontist, and just tons of Americans come there for work, in the pharmacy. So, heck, there was just tons of Americans there. So I kind of felt relieved once I got there. And of course, we had a guy that was worked for Megagen, and he's from Mexico. And he took us around, and they shuttled us back and forth, and I never once felt like I was in harm's way.
So you already knew what we were doing with this Arizona homeless vet, the Cass Institute with Chris Volchek. You already knew that. So does that mean you're a Megagen implant placer?
Oh yes, place hundreds and hundreds of them.
And, okay, so I did not know that that was your brand. Why is that your brand? And because the dentists out there, my whole motto from the very beginning is that we can use technology like the internet, podcast,
right?
So that no dentist ever has to practice solo again. And bottom line, when you walk into a dental convention, there's almost 300 different implant companies selling. Great. So why did you pick one versus all the others?
The way the implant looks after it's restored in the mouth, the gum tissue around it, the way the implant's made to maintain that crestal bone, because it's got the platform switching. And
okay, explain platform switching. Someone might not understand.
Well, you have biologic width. You got to be 2 millimeters or so from where the crown margin is to the bone level. That's more of a vertical biologic width. Well, you also have a horizontal biologic width where the implant ends on the side and the abutment begins. So from where the implant on the circumference ends to where the abutment is screwed into the implant, it's a stair step there. So you have your bacterial connection there, where the bacteria will stay on that connection of the abutment to the implant. It's away from the bone. So you don't have those toxins affecting the bone on the outside of the implant, on the edges where the screws are. Most implants, Zimmer and a bunch of other ones, the abutment sits exactly flush with the size of the implant. So when they drive the implant to the bone margin, and then you screw your abutment straight to that bone margin, well, the bacteria is going to get in that seam, and the bone's going to die away to the first thread, 2 millimeters away, a millimeter or so. So the bone's always going to try to get away from that attachment, that connection of the abutment to the implant, and Megagens are set in. And also the way the thread system is, it threads a little lower, so it maintains that bone on the buccal, especially the buccal, but buccal and lingual aspect. And,
you know why I think Megagen is so popular? The founder dentist actually has a corporate dentistry empire in Korea.
He does, yeah.
He has like 1,000 dentists working for them, and they couldn't get the implants modified as they wanted, so they started making their own. But what's interesting about Megagen is when they make a change in their implant, they have 1,000 dentists all placing implants all the time. Right. So they can do like a 5,000 implant study. I mean, they can get them all done the first month this thing comes out, so that they know in 6 months or a year what's going on. So he has probably the most rapid R&D program set up
He
for
does.
profit in his clinics. I mean, it's amazing. That main dental office, like a 10-story building in downtown Salt Creek, and every floor is one of the specialties. I mean, he's just an amazing dude.
Oh, it's
Just
amazing.
amazing.
You know,
Okay, so dentists are wondering, okay, so you're talking about platform switching. Are you cementing or screwing down? There's a lot of people.
uh,
There's a lot of people that think that one of the biggest problems with implant dentistry and peri-implantitis is excess cement.
well, you know, I do cement retain and I do screw retain. And in my office, we have a milling unit. It's an Origin. It mills zirconia crowns, titanium abutments, the zirconia titanium hybrid abutments.
It's a
We mill
CAD
those.
cam.
Yes, it's a CAD
And
cam.
what's the name of the CAD cam?
It's an Proteus 5X made by Origin.
Proteus 5X
Proteus.
made by Origin.
Origin, yeah.
Spell
It's
it.
an Origin. Origin.
And what's the website of that?
It's made by B&D Dental.
B&D Dental.
Yeah, they're out of Utah.
Wow. Do you know the
Yeah.
owner of that?
They're Korean.
They're okay. So they're just buying it from Korea.
Yeah, that's Korean owned, and they're American citizens, but they have this machine. I just when I have a crown made or abutment made, I just kind of wanted to do. I like doing lab work myself, so I bought the machine.
How much was
of course,
it?
It was about $100,000 with everything.
Okay, so my listeners, I know these homies. So basically, the number one selling brand would be obviously Sirona, which just got bought by Dentsply, probably the largest merger in dental history. Why? And then second biggest brand would probably be E4D, which just got bought by Plan Mecca out of Helsinki, Finland. Why did you go with the Korean model?
Well, this one it mills out solid zirconia crowns. It mills out titanium bars, roundhouse units. It mills out the titanium abutments. Mills out the zirconia hybrid abutments. So with a say a Cerac or E4D, you just milling out one crown at a time. But we mill out our abutments also. And so what I was getting to was when I do mill out these abutments or have an abutment made, with that implant, I can raise my cement line up to the gum level. So if you use a stock abutment and say it's lower on one side down below the gum line and you cement that crown down, you're going to get cement down beside that abutment. But if you raise your cement line up, your margin around to the level of the gum line is scalloped perfectly with the gum, you don't get that cement in there. But like I said, I do both cement retained and screw retained.
And what makes you do one versus the other?
Well, with screw retained, if you have some height limitations, say the crown's going to be a little shorter, you have to use a screw retained. The cement retained is going to be a little bit of a taller crown because you have to make the abutment and then you make the crown to go on top of that. So cement retained is one that it's a little taller, and the screw retained is actually can be a shorter, a crown. Of course, if it's a case, say if you're doing a roundhouse case, I would prefer a screw retained so I can retrieve it later, get it out and clean it, or if anything goes wrong, we can retrieve that. With the cement retained, it would be, impossible to get that off. So if I'm looking at something that I want to take off to clean, I'll make a screw retained. If it's a single crown, everything's good teeth beside it, I'll make a cement retained.
And when you place these, are you using a CBCT, a 3D X-ray, and do you do that for 3D for diagnosis and treatment plan, or do you also make surgical guides?
See, I have 3 offices, and 2 of them I have a CAT scan, Kodak. Use a Kodak CAT scan.
The CAT scan, the Carestream.
Uh-huh.
Kodak Carestream.
That's right. That's why I use a Kodak Carestream. And what we do is I use it a lot for pre-placement diagnosis and treatment planning. And after we place an implant, we take a CAT scan of the implant after it's placed to look at the placement, the bone on the buccal, lingual, every dimension. I think it's also good. It gives you a little bit of a safety net there, I guess, if you're having specialists, question you on what you're doing. You show them this CAT scan before and after, and had a board member here tell me in Louisiana, look, if something goes wrong with the general dentist placing an implant, the first thing I'm going to ask for is their pre-op CT scan and their post-op CT scan. So if they don't have that, that's an X against them right off the bat.
Well, that was one of the biggest complaints to Congress about all healthcare legislation is, they're not addressing the legal malpractice. And most experts believe that probably 75% of all x-rays are taken to cover your ass from lawyers, CYA for lawyers. And and we probably spend 30% of the American healthcare costs just on administrating insurance, and then a whole bunch of diagnostic tests on just covering your ass. So that's a reality.
I don't know when the last time was I charged for a CAT scan X-ray. I do them for free. I don't even charge for them.
So one of my complaints about implant surgery, continuing education, it's the same thing with cosmetic dentistry. You go to an AACD course, it's always about veneers. It's always 10 upper veneers and things like that. When veneers aren't even 1% of the industry.
No, they're less
and
than
96 out of 100 crowns are placed one at a time, and 96 out of 100 implants are placed one at a time. But when you go to an implant lecture surgery, it's always this big all on four. It's multiple sinus lifts and nerve reposition. It's all this crazy implant warrior stuff. But my listeners want to know how to place a single implant. And the most common missing tooth is a molar. And so for that molar, do you use a surgical guide, or since you have a tooth in front, the second bicuspid, and a tooth behind the second molar, and you're sitting at the 12 o'clock position looking down on that, do you need it? Do you need a surgical guide? Is it better, worse? Is it being anal? Talk about that.
Well, early on in my learning curve, I did use a surgical guide. Most of them model-based. I would make myself to get that position. I want it to be as centered as I could, and if you're going behind the tooth, you're always leaning towards the distal, and that's one thing we correct on a lot of our doctor students is when they go behind distal to a tooth, they're leaning that handpiece and they're going in distally inclined. So early on, I used a model-based stent. And then as I got going and placed a good many implants, I was doing them, do freehanded. And I do most of them freehanded unless I have something like a lateral that's anterior lateral is very, very close. So I'll get a stent for that, but I would say the majority of mine are free-handed.
Can you go over how you make so when you make a model-based surgical guide, you're not using any information from a CBCT?
No, and back then I didn't have one, and what I would do, I'd get the model and I would be looking straight down on the space, and I would take a high-speed or a lab drill and drill a burr in there directly where I want it, everything straight. And then I had these tubes that would slide over my burr and then make a stent out of acrylic or triad or whatever. And then when I would carry that to the mouth, after it was clean, of course, put it in there, and I'd make my first pilot hole drill right straight through into the jaw before I'd even lay a flap, So I could make that hole, and then when I laid a flap, I had a hole there, a landmark, because a lot of times you'll flap that tissue and then you're kind of lost, where everything is. So that gives you a landmark. Now, a lot of times when you do that, you'll notice I'm a little buckle here because the tissue fooled you. But all you got to do is move a little bit lingual, start your osteotomy, and then take an x-ray, and take x-rays as you go along. Drills, when you increase drill size, you take another x-ray, and, that would keep you straight. Now, as I go along, I don't use that much anymore because I've done it so much, kind of muscle memory, placing the implants, and I do most of them free-handed, and watch my steps as I go.
I think I have my diplomat in the International Congress of Implantology. I have my fellowship at Mission Institute. And I think one thing that you said, and I hope the young ones get it, is how when you lay a flap, your surgical guides, sometimes you can still be lost, and how before you laid a flap, you place that on and you punched a hole right through the tissue. So before you lose any landmarks or have bleeding, and a lot of times when you lay a flap, you don't even know if the surgical guide's down all the way and all this kind of
Right.
stuff like that. So that was a hell of a pearl there. So I want you to give your best Vince Lombardi speech on to this dentist listening. She's driving to work. She never placed an implant. What should she do? I mean, she's got to get her head in the right place. We both were in the American Academy of Implant Dentistry. Would you recommend she join that? I think what you specifically said was find a mentor first. How does she find a mentor? I mean, does she call a periodontist or oral surgeon? And she's probably thinking, well, the periodontist wants all the implants. She don't want to teach me anything. So how does, were you just lucky that you just lived near Jerome Smith and met him out drinking while you're telling your wives you're out fishing and you just fell in that? How does she find a mentor if she's not out getting drunk with Jerome Smith in the middle of the Gulf catching, what is it, redfish?
Redfish, yeah.
God dang, those are good to eat.
Well, they pull, yeah.
So you were saying find a mentor. How does she find a mentor? And talk about those baby steps.
Yeah, those at your local dental meeting. You're in town. A general dentist that's placing, implants and placing a lot of them. Or the AAID has a mentoring program. But most people will kind of stick local because it's good to have somebody in the same town with you, so you can call up, you can run over there. So at your local meetings, you can talk to them. Like you said, the specialists, most of them, they just tell you, just send them over here and we'll take care of that. Don't do that. But I always question Jerry, why are you teaching me to place implants? I'm right down the road from you, and gosh, I'm going to be taking up some of your business because I gave him I've sent him a bunch of cases before that, and I started doing my own. He goes, look, if I teach you, you're going to be doing these easier cases, and then the really hard cases, you're going to send to me. And that's what happened, until I got on my feet. But, with the dentist that's going down the road listening to this and wanting to know how to find a mentor, they know somebody in their town, just from the local association or some of their friends that know somebody. It's just this word of mouth, networking, somebody that you can get along with and talk to. And that's what I did. And most of the dentists that I talk to now, they met me at the courses where I would teach them, and now they call me up all the time, and I'll run over and help them. I'm helping one this Friday to do that. So that's how she met me, is through that course.
And see, that's what every intelligent, smart person always says. You never think in fear and scarcity. You always think in hope and growth and abundance. I mean, I remember when America got bombed at Pearl Harbor. Everybody was scared to death, and they thought San Francisco and L.A. and the Seattle and Portland was next. And Roosevelt said, living in fear is not an option. We're not going to live in fear. We're going to stand with these guys. And when you think in hope and growth and abundancy, like I noticed the orthodontist who would work with the locals that were doing their own ortho. It's orthos never usually lasts more than 4 or 5 years in a general dentist's office. They get really busy and they stop doing it. And then who do they send all their ortho to?
Exactly.
The guy who had the door open. And who's the guy that always has the door open? It's the person who likes people. They like friends. They like friends. All the specialists I know that will let anybody come in their office, they just like friends. They like people. They like people to go hang out with. They like people to go to the bar and watch NFL football with. They just like people. And so just look for that. Just look for that person who exudes like, I want a friend. I want more than one friend. I like people. Hell yeah, you come watch anything. I mean, if you're going to be a dentist from age 25 to 65 in 40 years, there's enough for everyone. I would tell that young dentist out there that just graduated from school, just start calling them. See who calls you back. See if on the phone you have chemistry, and just be able to have uncomfortable conversation. Just to be able to say, look, I know you place implants for a living, but I want to place implants for a living, and you know more than me. I don't know what you do, but I'm sure in the long run, we don't know each other today, and someday maybe I'll have referred you hundreds of implants because I'll find out what I like. I'll find out what I don't like. You know what I mean?
Oh yeah, yeah. And that's what we did, and that's what I did with my local orthodontist. Of course, they're the two biggest, orthodontists in town, and I do adult ortho, and I nothing bite related or anything like that. And I was kind of apprehensive to tell them, because we both deer hunt together too, but the same hunt. Yeah. And I said, I do adult ortho. I said, hope that's not a problem. He goes, oh, take the adults. They said they're a pain in the butt. You know, they want the braces off as soon as they get them on. He said, look, man, if you need anything, need a special wire bracket, call me up. I'll send one over to you. You know,
But you said the one working with you is the two busiest orthodontists.
to the most expensive and the busiest.
Yeah, and what are they doing? They're thinking in hope, growth, abundancy. They're helping the locals do it. It's just the mindset is everything. So I want you to start talking to my listeners the mindset of getting them from fear and scarcity and I can't place an implant. I've never placed an implant. Talk to them for a few minutes on get your mind in the right place. You're going to place an implant. And 10 years from now, you're going to have placed 100 implants. What do they need to start thinking?
Man, you know, I guess, you know, if they're scared, you know, they got to get some knowledge underneath the belt, the basic knowledge of implant dentistry. And I don't know what they're teaching now. I've been out for 10 years, but I assume it's not much they're teaching in dental school right now.
Not much implants or ortho.
No, so, you know, you get your basic from, you know, I hate to say it, but a weekend course where they kind of go over the basics of it. And then after you know, get a mentor, talk to somebody or have somebody to talk to. You know, my first one I placed was in the second mandibular premolar area where it's congenitally missing tooth. Now I had 20 millimeters to the nerve. You know, it's a big fat ridge, and went in there and did what I was supposed to do, placed it. They both come out perfect. Felt pretty good about that, you know, and I just did those easier cases where I had so much safety net. I didn't have a drill big enough for me to drill down and hit anything that had a name, you know, anything. That's why I tell my guys.
Okay, Socrates said humans have two emotions, greed and fear. So describe the low-hanging fruit, easy single implant cases, greed, I can do this, and then fear, what you definitely don't want to start with.
Well, you know, in the first molar area, mandibular first molar, like we said, you know, there's a lot of those missing out there. And you look at one that, you know, we had one this weekend. It was 16 millimeters wide, 20 millimeters to the nerve down there. And, you know, it was a no-brainer.
Was it a Cro-Magnon or a Neanderthal or Peking Man or Java Man?
Well, after we got through placing 8 implants on him, he went down the hall to the oral surgeon, and he chiseled off a bunch of mandibular tori off of him, too. So, you know, this guy had 3 surgeries done, but it was just a big jaw. And the first molar, you know, the upper bicuspid up there, big wide, you know, one that's way away from the sinus. And you start getting that feel of how the bone feels. You know, how it feels when you go through. You know, most of them will freak out when they break through that first cortical plate and it drops in real fast. They think, you know, they've done something wrong. But, you know, that's what you do. You start off with those easy cases. Stay away from anteriors. Anteriors, you know, they'll bite you. The smile zone. I always get my patients to smile at me real big before we start, so I'll see if I can see the bottom part of their nose when they smile, you know, or if I can barely see their teeth. But, you know, pick those cases like that, the areas that are generally safe. Mandibular first molars, there's a lot of those missing. If you go on back to the second molar area back there, you know, it'll get a little more narrow and the nerve starts to curl up. That's something for a little later. Like I said, the anterior, that's something for a little later. You have to have some more implants under your belt, some more education. And then, you know, after that, you get into moving the sinus out of the way. Once you figure out how to move the sinus, that opens your door up to a lot more implant cases when you can do that. But I think what a lot of people get in trouble with is they get out of dental school, and what's the average debt that a student has now at dental school?
$250,000.
Yeah.
But I'm trying to get the number. What is the average cost of the first divorce? I know it's over $1 million. So
yeah, that's right.
So I still think my divorce was 47 times more expensive than my student loan debt. So I don't want to listen to student loan debt. That's an amateur financial problem.
That's an amateur financial problem. But you know, they get out, and to them it's not amateur, and they're like, you know, they might want to try to place every implant they can, and that's where you get into trouble, is when the money starts driving the issue. You know, I can put this implant in and make this much money.
And that's why a dentist should want to be financially successful, because financially successful dentists aren't desperate.
No.
I mean, I've only ever done what I've never traded time for money. I've always played. I've always enjoyed. And whenever it wasn't fun anymore, I quit doing it, referred it out, got an associate. I've been playing for 28 years. I still don't think I've ever worked a day in my life. And other people that don't know me think, God, that guy works hard. It's like, really? I don't think I've ever worked a day in my life. I mean, I grew up working for my dad, and I mean, who doesn't want to spend the whole day with their dad? I mean, he was the coolest guy I ever met in my life. And then, you know, so you want to be successful, so you don't have to do anything for money. Because when you have to do things for money, you can get depressed, and you can do things, you can get in over your head, and, you know, just do it because you love it. Do it because it's fun.
I had a friend the other day, you know, he was like, dread Monday. I said, why is that? Well, I got this big case. We did this, and man, I hope that goes in and hope this fits. I'm like, well, man, you're doing it wrong. You know, if you're that worried about it, you know, something's missing in your steps. You know, you don't have those steps correct. You know, where you know it's going to be fine. You know.
Now, when you're picking an implant company, now I know a lot of my friends, like Tom Mattern, he's my best friend, dentist, and my zip code. We went to Creighton together. He used Megagen, but I think a big part of it is because he's in love with the rep Joel Gonzalez.
Joel.
Yeah. Oh, you know Joe.
Yeah.
Do you if this person, you know, she's looking for a mentor, so she's calling oral surgeons, periodontist, you know, will you mentor me? Do you think a rep is a big part of it too? Because you can buy implants online. You can buy implants online from a dozen different countries for a lower price. But it seems to me, people like Tarun Agarwal, a great friend of mine and mentor of mine, he used Noble BioCare for the same reason. He only uses it because he's in love with the rep there. And it seems like everybody that just is getting it done has a really close relationship with a rep. And the rep is fixing it up with mentors. Like the rep might say, you know what, this is a big issue. You need to talk to so-and-so. Let's go have lunch with so-and-so. Or here's his number. Here's his cell phone number. What do you think about the rep's involvement in choosing your implant company?
I would say half of the people that have that would seek me out as a mentor was sent from the rep. You know, because they feel confident of talking to that rep because, you know, of course the rep's trying to sell them something, but, you know, they hooked them up. It's like I said, it's word of mouth. And, you know, I placed Ankylos for a good many years. It had that same, you know, connection like the Megagen did. And the female dentist I'm helping this Friday, that's how she got in contact with me, was through the rep. You know, and I think it was Dent Supply was one had that, or Free Dent, whatever. But that's how we got hooked up. Now, most of them now are when I teach a course and I get in contact with them like that. But the reps have a big, you know, a lot of skin in the game.
You know what? When people ask me what supply company I buy my supplies from, I've actually bought them from 3 companies. But you know why I've changed companies every single time?
The rep?
Because my assistant Jan's been with me 28 years, and she's been following this one rep who she absolutely adores. So when she changes companies, I mean, Jan doesn't care who backfills the order. She has a relationship with Valerie, and she just loves her. You know what I mean?
Right.
If Valerie switched to Acne Dental Supplies, that's who she'd go with. And it's that value-added relationship for someone to say, well, your buddy Tom uses this, and Al uses this. In fact, my son the other day wanted to look at a different sterilization setup, and she gave him 3 names that she would take him to their office, and she said, we don't even need to call. We'll just walk in, and you can see how he sets up everything and everything. And it's that relationship. And when you have that relationship, it just gets done. But too many anal dentists who studied calculus, trig, and geometry say, well, I can save $9.14 if I buy on a website from, you know, Kathmandu. And it's like, okay, but you're the same guy who's not placing any implants.
Exactly. We know they do save a little money, go on, you know, online or something like that. But, you know, I can get on my cell phone. I text Scott, you know, who's my rep, and say, hey, man, I got a problem with this. They'll run on by, fix it for me. I don't have to pay for a service call. How much would that be, you know? And then we're buddies, and, you know, we hunt together and all that kind of good stuff, too. And, you know I can call him. He's going to be there. He's going to take care of me. And, you know, that's why he's successful, too, because, you know, that's the way he is, you know. He's somebody you can approach.
So would you recommend joining the American Academy of Implant Dentistry?
You know, when I joined it, I guess I joined it out of fear. When I first started doing it, because the oral surgeon we had in town, he didn't even want periodontists to place implants, and he still does it.
Well, Brandmark started.
Yeah.
Brandmark. Yeah. He only allowed oral surgeons.
Yeah. Well, so, you know, he actually taught me anatomy and pathology in hygiene school. You know, so yeah, this guy did, and I went on to dental school and I did my whole thing. So I was like, I got to have some credentials behind my name, something that shows that, I know something about this. So the AAID bona fide, credentialing in there, I went in and took the test and took the oral test and became an associate fellow and moved up from there. So one day, me and this oral surgeon was on a plane ride, a plane coming back from, I think, the AAID, and I saw him. We were getting our luggage. And, hey, what's going on? He's like, hey, heard you're placing some implants. Yeah. How many you placed? Oh, about 1,500. He's like, that many? He said, and he just questioned me over and over again. He said, well, why do you think you can do that? What's your education? And I stepped him through the whole thing, how many I placed and my credentials, and he goes, okay, that sounds good to me. Shook my hand and walked off. And he
did you tell him you graduated first in your class in dental school?
No, I didn't tell him that.
And you know what? It's funny because, I'm sorry, but didn't specialists do their first root canal one day?
They did their first root canal one day. That's right.
And the ones that seem like are the most cocky in Arizona, the ones that just, there's high and mighty. I know the name of the endodontist who does that endodontist's retreats. It's
right.
Like, just shut up and be humble. Same thing when a kid's screaming on an airplane and people get all upset. I don't know if it's because I had raised 4 boys, but I always turn to them and say, well, how old were you when you were born?
Yeah, I feel sorry for the person, But the funny thing was, one of my best friends is an endodontist, and he was taking the live implant surgery course this past weekend, placing implants, and he's been placing some implants as an endodontist. Gets in there, the tooth's cracked or whatever, and he's learning how to.
Well, I'll tell you what, I've had more. I can't count the number of dentists who, we were earlier talking about desperate people do desperate things.
Right.
So if you send a failed root canal to an endodontist, and the only way he can feed his family is to do a retreat or an apicoectomy, but he knows that's going to be in the trash in a year, then is he going to just do a retreat and then think, well, I did the best I could. I did what I could. I mean, it's not my fault. It's like baloney. You know that tooth should have been extracted and placed an implant, but you don't have a 3D x-ray machine. You don't know how to do it. So you just say, oh, I did the best I could. Well, do you have a warranty on it that if it's extracted in a year, you'll give half the money back? Oh, no. I'll tell you what. There's a lot of endodontists. I trust an endodontist 1,000 times more if they can also feed their family by placing an implant. I think that's the future. I don't think the future is apicoectomies and retrofills. I don't think it's microscopes, all this fancy dancy stuff. It comes to a point where you just pull that damn tooth and place titanium. Do you agree, or is that too aggressive?
Oh, no, I agree. And, and when I really started seeing the light is when I do a root canal and something not work out. I'm like, what is going on? Of course, whatever that patient spent on that root canal, that crown, I put towards an implant. I do that. Or if anything goes wrong, I always put that money towards, an implant.
If you did it or the endodontist did it?
Oh, if I did it.
So you're saying if you do a root canal, billet, and crown that fails, you just credit that to the implant?
Oh, every time, yeah.
That is so damn cool. I like you even more now.
Well,
now I'm falling in love with you.
Well, the thing is, then you look up and you got 10 of their family members coming to you now. They're like, "Oh, what's going on?" It's the best referral too. I didn't mean for it to be that way.
I know. I've done that for 20 years. If I do it and it fails, it's all just rolled over and credit into how we're gonna fix this damn thing. And here's the catch-22: the endodontist that doesn't have the CBCT. Who just says, well, I tried to retreat, it didn't work, and I don't get any money back. Yeah. Well, the ones that have the CBCT know that it shouldn't be an implant, but since they have a CBCT, they place the implants. Right. And the one that doesn't have the CBCT is Stevie Wonder in there, just doing the best he can with no refund policy.
Right.
So I mean, it's almost a checklist. I call your nose. Do you have a CBCT or do you have access to one? Do you use some of these on failed root canals? And do you see if this is even worth a retreat? Do you have a refund policy? And if it does, if you do the retreat and it's in the trash in a year, what % of that is credited towards the implant that you're going to place? And if all those answers are no, and you're in a big city with a bunch of endodontists, go reward that young guy, that young endodontist who bought a $150,000 CBCT, who takes 3D pictures of these failed root canals and says, no, this thing cracked. And I'll give you some hints on it. A 3-rooted maxillary molar, there's no give. Right. So it's like if you drop a porcelain plate, it just shatters. A 1-root canine has a lot of gives. A lower molar's in the middle with 2 roots. But I'm telling you, a lot of these failed 3-rooted teeth, they're all broken, fractured. And then downstairs on a molar, 2 roots doesn't have much give. It only can really rock buccal lingual, not mesial distal. It's the canine. It's the 1-rooted teeth that are like a fence post that have a lot of give. That maybe a retreat will work.
That's right. Yeah, and he and I were talking about it this weekend. He's like, used to I do an apico, but now, I just tell him, hey, it needs to come out. We need to do an implant on there, whether somebody else does it or he does it or whatever he feels comfortable doing. I admire that because, like you said, that a patient come back the other day and the endodontic said, yeah, I can do it, but it might last about a year, maybe. So she was like, well, I want an implant, and he sent her back.
And my personal deal, I've thought about this a lot, is the average man in America lives to be almost 75, and the average woman's 80. So if it's I warranty it 5 years. I mean, if what you're doing can't last 5 years, then what are you doing? I mean, the patient's going to live to be 80. So if they're going to live 80 and you're working on a 40-year-old and it's not even going to get him 5 years, and it's not going to give him 5 years, you did the wrong diagnosis and treatment. You got to diagnose aggressively where you can sit back and say, that thing will last 5 years, or I'll give you your money back credited towards the next procedure.
That's right. And, that's why I think you hit on a note with me a while ago saying that you don't work, you have fun, doing what you do. You enjoy your work. And if you start looking at your schedule and seeing that person you did a root canal on 3 years ago, problem with that tooth, they write down what's wrong. You get that sinking feeling about you, something's not right. I don't get that because I know, hey, I'm going to take care of it. Don't worry about it, And
you know what the non-implant dentists don't do? The non-implant dentist, anterior tooth snaps to the gum line. Well, why does it snap? Because they're older, it's dry and brittle. So the only thing you know how to do is do a root canal, try to get a 2-millimeter furrow, do some big post build-up thing, put a crown on, and within 5 years, every single time, they walk into your office and it's in their hand. And the only reason you did that treatment is because you didn't know how to pull it and do an implant.
Yep.
So talk about that exact case. So someone comes into you, say they're as old as me, they're 53, the lateral and maxillary inside, number 7, had a root canal build up in PFM, snaps at the gum line. Talk us through that. What would you do? Would you pull that, place the implant, go through that exact scenario?
I had one this past week, came in the same thing, and of course with the Megagen, you get real good initial stability. So go in there, tell the patient, look, I can't put a post in this. It's going to fracture. I had to make a long crown on it to even get enough to hang on to it. I explained it to them. Have digital X-ray, so you can just bring it up on the X-ray, and they can see that X-ray, and they get it. They can understand that most of the time. So I said, we need an implant here. Showed them a couple of pictures, and then they said, yeah. So we went ahead and placed the implant that day, and had a couple of other dentists work with me, so they could take the slack up. And we try to do same-day dentistry if we can because they're there and they want it done. And we put the implant in. We have something called a fuse abutment that Megagen makes, that if they overload that for some reason, 200 newton centimeters, the abutment snaps off. The temporary abutment does. So you won't overload your implant. And I made her immediate temporary that day on that case. Now, sometimes I'll go in there and place it and then make a little suck down or bond the teeth next to the other teeth and put her a little provisional in there. But yeah, I just won't put I used to put posts in there, but like you said, they come right back in a few years later and it's in their hand, and there you go again. So you're going to save yourself money by doing it, the right way the first time.
So Vance, do you put RDH, DDS after your name, or do you just go DDS?
Not just DDS. Yeah,
I think you should have the RDH, DDS, and then build Dentaltown, start building some online courses. I'd love to have a RDH, DDS, do how that everyone can watch on how to do a cleaning around hygiene, all the things you have to think about. And I wish you'd start building some courses because everybody I know that knows you says you're just an all-American boy. You're their idol. You're just good from your head to your toes, and you're just crushing it. And I am into triple overtime. I just have to cut these off at 1 hour. We're at 1 hour and 4 minutes. But I just want to tell you, dude, seriously, I'm a big fan of your post on Dentaltown. I'm a big fan of you. Thank you so much for spending an hour with me. And someday we're going to either meet at the CAS facility in Arizona on the VETS or Tijuana or your office or drinking with Jerome Smith and Danny and out red bass fishing or red fishing.
Okay, sounds good.